So your hernia at the belly button will need to be repaired, and all operations potentially have complications. The complications for umbilical hernia repair are pretty well known and pretty infrequent, and usually things go well, but you do need to know what you're up against and what potentially can go sideways on you. So let's make sure that you are aware of that, and we'll be aware of that and trying to minimize any potential for that during your operation. So any operation has potential for causing pain, any scar anywhere. If your umbilical hernia is repaired with an incision in the middle or with an incision off to the side to get in with a laparoscope, there's potential for nerves to get tangled up in the operation and in the scarring process. That's not a common process. Certainly you have the trauma of surgery. Everybody has the worst pain for the first couple of days after surgery. Generally it backs off. If you overdo, you're going to have more pain. But the subject of chronic pain is one that is not common. I've had 13 patients, to my knowledge, in 25 years that have had this problem. And for many of those, for 6 of them, they had no pain at all for a number of years, and then they came in later having gained 40 pounds and have developed pain where the stitches are digging into them. This is a bit of a random thing, but anywhere you put the mesh in, you got to put in some permanent stitches, or the mesh can fold, it can shrink, or it can migrate out of where it's supposed to be. So those permanent stitches hold the mesh in place and keep you from getting into trouble with recurrences. And we put in as few permanent stitches as we can because where they go through can be near a nerve. If it's right through a nerve or right on a nerve, you'll have pain that won't go away, that will be aggravated by any motion that twists the trunk, and you'll generally be able to say, right here, when I turn this way, whew, you know, it really hurts. And the cure for that is not to take the mesh out and is not to give you a bunch of pain pills, but instead to go back in with a small incision and take the stitch out that's right there. And you'll usually be able to point to right where it is. For the patients that have come in 8 or 10 years later, the same process goes on. It's just that initially their nerve was close but not right on, but as their belly stretched out, the mesh won't stretch and the nerve gets dug into by a stitch being drug across it. Same thing, they get better with you take the stitch out. So that's uncommon. I see that in one patient every 2 years or so. But if it happens, there's a solution that reliably gets you out of that problem. You will be told by attorneys that the problem is really the mesh, but my experience is the mesh is important for the repair, and the problem is probably a nerve and a stitch. All hernia repairs have some predilection to recurring. The more you're overweight, the greater the chance that you're stretching there and that things are going to fall apart. I'm preaching to myself here, but if you've got a pot belly, the balloon's bursting when you have a hernia. And we can fix it and we can make it stronger there, but you may pop a hernia out around the sides of the mesh or somewhere else, say in your groin later on, if you continue to let the balloon get bigger. So anytime you've got a hernia in the abdominal cavity, be thinking long-term weight loss, tone up the muscles, and take the strain off the abdominal cavity. But with recurrences, it's real important to follow instructions and allow everything to heal well. So we'll have a 15-pound lifting restrictions for 4 weeks. We'll have a restriction of 50 pounds out to 6 weeks, and this is why. Any operation in the belly cavity, there's some risk of injury to the intestines. Sometimes if you have an incarcerated hernia and the guts are popping up through the hole and we can't get it pulled back in, we'll have to open you up and push it back in rather than pull it back in to keep from tearing the intestines. We're operating in the belly cavity, and any operation in the belly cavity can be associated with internal injury to the intestines. That will manifest with severe pain within 24 to 48 hours. That's happened to 2 of my patients in 25 years. Both of them had extensive abdominal adhesions internally that made the operation inherently riskier because there are a lot of adhesions to take down that can involve the intestines. If I run into that situation, frequently I'll pull out and we'll do an open operation rather than a laparoscopic operation. And sometimes that will be the surgeon's choice from the start to avoid that potential problem, to just do it as an open operation. So generally, your umbilical hernia repair will have discomfort for the first couple of days, disability in terms of your activities for 6 weeks, and then you'll get back and encourage you to tone up your muscles, stretch out, and get back to normal activities again.